my name's Alan Moffat, Clinical Director at ProCare, and we're here today at the college conference interviewing Professor Michael Kidd, who's the Executive Dean of the Faculty of Medicine, Health Science and Nursing at Flinders University, South Australia. Michael's also President of WONCA, the World Organisation of National Colleges, Academies and Academic Associations of Family Doctors, more commonly known as the World Organisation of Family Doctors. So, Michael, would you like to just tell us briefly, what does your role as President entail?
Well, the WONCA is the World Organisation of Family Doctors. Our members are the colleges and academies of general practice and family medicine in countries all around the world. Through our college members, we currently represent about 600,000 family doctors in over 150 countries. And our member organisations include the Royal New Zealand College of General Practitioners. WONCA's global role is to be an advocate for family medicine. All around the world, we work very closely with the World Health Organisation and other United Nations agencies, and we really promote general practice and family medicine as a way of strengthening primary health care and ensuring that healthcare is available to all people in all countries of the world.
Right. What do you see as the major challenges facing general practice for the future?
Well, there are global challenges and there are local challenges. We have a number of very big global challenges. The biggest challenge we have is universal health coverage. How do we ensure that every person in every community, in every country gets access to the healthcare that they need? And this is part of the agenda for the United Nations with the Sustainable Development Goals, which were released last year, setting challenges for the world on how do we make the world a better place and make things more equitable for all people. In countries like Australia and New Zealand, we have the challenge of the ageing of our population. So how do we structure our healthcare systems to best provide healthcare to our increasing numbers of elderly people? We have challenges in the affordability of healthcare, with a lot of our healthcare expenditure going on high-tech tertiary care solutions and neglect in many countries of the need to invest strongly in primary care and strongly in prevention and health promotion, better management of chronic disease and mental health. We have continuing challenges of being prepared for communicable diseases as well as for non-communicable diseases. And primary care and general practice is seen as a solution to both of these. We need strong primary care to manage the rise in chronic disease, which is affecting many of our people in our populations, especially again as the population ages. Primary care is the best place to manage comorbidities, so people with more than one chronic health care challenge. Primary care is a very important site to integrate mental health care with physical health care. In many countries, unlike New Zealand, the two are separate, and so a lot of our global work is looking at how can we integrate mental health into primary care, and again to lead to better healthcare outcomes for our populations.
Right. How do you believe general practice should respond to some of those challenges, perhaps at a more local sort of level? What's your thoughts
Well,
about
I think
that?
New Zealand is actually a great example of a country which has a very strong system of primary care based on strong general practice. And not just general practitioners, but the entire general practice team. And New Zealand has really been at the forefront in developing the model of team-based care and more integrated care. And this has produced great outcomes for your population. And it's a model that we need to be sharing with not just other high-income countries, but with low and middle-income countries around the world which are struggling to look at solutions to meet the healthcare needs of their entire populations. I think that the secret to healthcare in the future is going to be hospital avoidance if we want our healthcare systems to remain affordable. And particularly with our ageing population, we want to keep people as well as possible and for as long as possible, and at home for as long as possible, which is what people would prefer. And so again, these are solutions that primary care has the answers to.
Indeed, we've embarked on this country into sort of a performance system level measures across the system for primary care, and a big focus of that is on avoidance of ambulatory sensitive hospitalisations or acute bed days. And I'm aware of a lot of the work in Australia around those similar sort of focuses. One of the things we were discussing earlier was the healthcare home model, which I know the Australian government's investing in. Do you want to give us a little bit of your sort of views about how that's going and what are the key components?
Well, it's interesting because when I first heard about healthcare homes and I looked at what the model was, I thought, this is good general practice. This is probably what every general practice should be doing. Good integrated care, team-based care, people being able to come to the one-stop primary care shop to get a lot of their healthcare needs met. Community outreach from the centre as well. So these look like things which are the foundations of basic good general practice, good primary care, and indeed that's how the models are rolling out in many different parts of the world. Sometimes you need a handle in order to attract the attention of policymakers and politicians and the general population, and that's okay. And so in Australia we've seen, as in New Zealand, a move over the past few decades away from solo general practice to group-based practices with the support of primary care nurses, general practice nurses, and increasingly other healthcare professionals working in those settings as well. And at the same time, the digitisation of healthcare information at the practice level is enabling us to improve the care for many of our patients with chronic disease and complex comorbidities by being able to identify who these people are, by being able to have good systems of recall to get people back for follow-up as needs be. I think increasingly in a number of countries we're seeing more outreach work from the clinics, so more care being directed to people in their homes, particularly the frail, elderly and people with disability who may have difficulty coming to our clinics, to make sure that people aren't missing out on the care that they need.
Right. And one of the things that we're looking at as part of those measurement of general practice, I guess, is the wide amount of unexplained variation that exists. What's your take on that, and whether that's an issue that we should be doing more about?
Well, variation can be a good thing as well as a troubling thing. There are reasons why you see variation between practices, which relates to the practice populations that either exist in that local community or the populations who are attracted to go to a specific clinic for whatever reasons. May be related to the age or gender or ethnicity of the doctors working in that setting. It may be whether the practice setting is in the inner city or in a rural or remote area. We expect to see variations. So variation's okay, as long as we can explain it. There's been quite a lot of work, particularly in the UK, looking at the standardisation, for example, of guidelines for the management of clinical conditions. In Australia, we're looking particularly at guidelines and at the shortcoming of guidelines, because most guidelines are developed for single conditions. And most of my patients have more than one condition, and there are no guidelines for that. So you look at the guideline and you say, that doesn't relate to the patient that I'm seeing. So, I think there are a lot of reasons for the variations. I think there are some challenges in some of these pay-for-performance models which we see around the world, because some of them do drive, if you're paying for something, then that's what people will do. Yes. And that may result in neglect of other things which actually should be being done to look after a community and that community's health. So it's important to get a balance in how these reforms work, and to approach them, I think, in a way where at the very crux of what we're doing, we think, how is this going to improve the healthcare of the people in this community, and is it going to lead to better health outcomes, or is it going to lead to aberrant behaviours which we may not actually want to encourage? And there's probably enough experience to be able to predict how some of those things are going to happen. But one of the things that does strike me is that often you see the same mistakes being made in different countries after each other. And I think that one of the important things we can do through WONCA and through our colleges and our primary care organisations is to share our experiences, both within the country but also across borders internationally as well. And we can also learn things from what's happening in other parts of the world. I think one of the greatest insights I've gained as president of WONCA is how much wealthy countries like New Zealand and Australia have to learn from the developments which are occurring in low and middle income countries around the world, where new solutions are being developed to address the challenges of delivering care to people who are marginalised, people who may be very vulnerable in the community, people who live in remote areas, innovative use of new technologies to deliver healthcare messages and deliver healthcare services, and new models of care with new people coming into the healthcare team to support what we're doing, and particularly the increased focus in providing care away from the clinic and out in the community, which was very much part of general practice when I was growing up in Australia. It then stopped, and I think it's going to expand again in many of our countries.
Michael, I understand that there's a WONCA conference in Cairns next year.
There is. This is our WONCA Rural Conference. So every year or so, WONCA has a global conference focusing on rural family medicine, rural general practice. And next year's conference in April 2017 is being held in beautiful Cairns on the Great Barrier Reef in Australia. And this will be an amazing event because there'll be rural doctors from all over the world coming to the conference, talking about the challenges in delivering care in rural communities, and sharing insights, sharing success stories, sharing resources. It's going to be a wonderful event. Particularly there'll be doctors from rural and remote areas in low and middle income countries there as well. So I hope that lots of people from New Zealand will come across. There's lots of messages to be shared from the successes in rural practice here in New Zealand, and I'm sure lots of lessons to be learned and lots of new friends to make among the rural doctors of the world.
Awesome. People can get more details from the website.
Fantastic. Thank you.